Namaste, this is Dr. Anoop. Today we are going to talk about COVID-19 infection and heart disease. It will be a Q&A session, and I have compiled all the various questions that patients have asked me over the last few weeks, and essentially I'll try to answer those in a narrative format. So one of the questions that patients ask is, are patients with heart disease at higher risk of getting COVID? And the answer is no. Their risk of getting COVID infection is same as any other person. The second question that patients ask is, are patients at higher risk of getting severe form of COVID if they have an underlying heart disease? And here the answer is yes. Patients who have underlying heart disease, they tend to have more complications of a COVID infection as compared to patients who don't have heart disease. Okay, another question patients ask often is, can COVID infection itself cause heart disease? And the answer is yes and no. COVID infection at the time of infection, when patients are sick in the hospital, it can cause temporary damage to the heart, which can be mild, which can be severe. Another question patient asks me is, I never had a heart disease. During the last COVID infection, my doctor told me that my heart had a little bit of damage. Does that mean now I have a heart disease? And the answer is no. Why? Because most of the COVID-related damage to the heart that eventually recovers typically takes few weeks to few months. So if COVID caused the heart damage, and if you are doing okay now, there is a very good chance all of that damage is going to recover. Another common question is, do patients with heart disease need to take any special precautions? And the answer is not particularly. Patients with heart disease need to take the same kind of precautions to prevent COVID infection as patients without heart disease. It's just that the cost of COVID infection in patients with heart disease is so high that those patients, they should take extra care of themselves, which means they need to be very particular about following COVID precautions to make sure that they are masked all the time whenever they are going out or whenever they are in a crowd. And they should maintain physical distancing. They should eat healthy. They should take their medications appropriately. If they are vitamin deficient, then they should replace that. They should follow their treating physician's advice, particularly routine follow-ups, routine investigations. They should not be postponed because that can certainly precipitate some of the heart problem that they may be having. Another common question that is being asked is, do patients with heart disease need to start or stop their regular cardiac medications? And the answer is no. Most of the heart-related medications, they can be continued even if you develop COVID infection. And if you have any doubts about it, please directly talk to your treating doctor. Another common question that is asked is, do patients with heart disease, if they get COVID infection, need to consult a doctor for COVID treatment? And the answer is yes. The reason why you need to consult a doctor is because there is a lot of interplay between COVID infection and your heart disease. So you may not need any special medication for COVID, or your COVID may be asymptomatic or may be very mild, but still it is important to inform your treating doctor or your cardiologist that you are infected with COVID, so that if there is any special precaution that you need to take, your doctor will be able to suggest to you based upon your particular scenario. Questions about vaccines are pretty common. So are these vaccines safe for heart patients? And the answer is absolutely yes. They are safe for heart patients just as they are safe for anybody else. Another common question is, do patients with heart disease, should they take vaccine? And the answer is yes, you should. Patients with heart disease, as I said, if they get COVID infection, it can be very severe. So you should get vaccinated whenever it's your turn or whenever you get a chance. Another question is, which vaccine should I take? And in India, we have got 3 vaccines available now: Covishield, Covaxin, and Sputnik V. And all 3 vaccines have been reasonably tested in human beings. They work very well. And you should take whichever is available to you. Another common question asked is, do we need to stop any medications for us to take a vaccine? And most of the medications, they don't need any kind of adjustment. You can simply just go ahead with a vaccination. And if you have any doubts, you can talk to your doctor. If you are on blood thinners, even then you should be able to take the vaccines. Word of caution, if you are taking medications with the name warfarin or warf or acetrom, then you should better get your blood test checked. The blood test is called PT-INR. We recommend that the blood test level should be below 3 for you to get vaccine. If it is more than 3, then you should talk to a doctor in terms of what is the best time for you to get the vaccination. So these were some of the common COVID-related questions that patients with heart disease, they often ask me. If you do have any questions which I have not answered, please feel free to WhatsApp me on the number provided below. For some reason you are not able to contact your cardiologist, and if there is some question that I can answer, that also you can WhatsApp me. I'll be very happy to help you with that. In this COVID pandemic, please stay safe and stay healthy. Thank you.